Steve Lackmeyer here. I'm a business writer with the Oklahoman. On Wednesday, October 10th, I hosted a panel discussion on an OKC Central Google Hangout and live chat about the ongoing development and growth of an area just east of downtown Oklahoma City known as the Oklahoma Health Center. Those visiting with me were Jerry Askins, Associate Provost for External Relations at the University of Oklahoma Health Sciences Center, Chuck Spicer, CEO of the Children's Hospital at OU Medical Center, Dean Gandy with the University Hospitals Authority and Trust, and Jorge Charneco, Senior Vice President over Health and Science Technology and Architect at Miles Associates. One of the things that right off the bat, some people struggle with is, are we talking about the Oklahoma Health Center, OU Medical Center, Presbyterian Health Foundation, Research Park? And I was hoping to start with you, Dean, a little bit about just a brief history of this area. It's really been going on much longer than people think, hasn't it?
Yeah, and you know what? Actually, I think Herschel might be better suited for an overview since he coordinates all of the entities and agencies on the campus.
Yeah, but Herschel's not. We've got you on this. Herschel's not with us today.
Oh, he's not?
No.
I was told he was. I'm sorry.
It's all right.
Okay.
But yeah, if you could talk a little bit about how all the, a little bit of a history of the area.
Okay.
Okay. If you could just give us a little bit of a history of, it's been around for like a half century at least, hasn't it? Can you hear me?
Yes, I can. I didn't know if we were live or not. Okay, so
yeah.
You just want me to...
Yeah, we're live. It's all new. Don't worry about it. We are live.
Very good. Of course, the Health Center started back in the early 60s with five founding fathers, all leading businessmen in the city who recognized the need for advanced healthcare, medical education, medical research for Oklahoma and its citizens. And from that beginning, we are what we are today, which is a multi-entity agency enterprise consisting of federal, state, local governments. I represent the state of Oklahoma as the University Hospitals Authority and Trust. We receive state appropriated dollars to take care of those in need of health care. But the enterprise goes well beyond that. Obviously, the University of Oklahoma, with its teaching mission, has 7 colleges. You have the College of Medicine, College of Dentistry, Pharmacy, Graduate College, Nursing, Allied Health, and Health. So all of those colleges make up the University of Oklahoma's mission to provide for medical setting, research, and education here on the campus. But then you have a variety of other activities. You have some 501c3s whose mission is to support, whether it's the Children's Hospital Foundation, supporting children's research care here on the campus, OMRF, which is a medical research institute that provides tremendous research opportunity, and then you have the research park itself. That was originally part of the Presbyterian Hospital sold to what is now today HCA. They developed a foundation and began a research park that is a tremendous support for the campus as well. You have the Blood Institute, Dean McGee Eye Institute. So there are a variety of, I think there are over 28, probably now over 30, different activities and agencies on the campus.
How many employees do we have out there, Dean? Is there any estimate?
You know, I'm going to defer. I don't know in total. I know we have over 700 physicians. The total enterprise, honestly, I don't have an answer for that.
I think that actually I've got an idea on that because of United Way. Can you hear me?
Yes, I can.
Okay.
This is Chuck Spicer, CEO Children's Hospital.
Yeah, I think the number on the campus is approaching 10,000 employees on the campus between all the different entities, VA, the hospitals, the university, et cetera.
I think that's probably right, Chuck. I think we're probably larger than most towns and cities in Oklahoma.
It's an amazing boost to Oklahoma City's economy, what we've got going on out there. I did a story a couple of years ago where they were talking about we had about $500 million of construction going on, which almost is as much as Devon Energy Center and what's going on downtown. But you don't hear as much about that area as you do about downtown, and that may be my fault, and we need to do better at that. But people really don't appreciate this area maybe as much as I should. I mean, Lieutenant Governor, when you were doing economic development, how much did you hear the Oklahoma Health Center and all that going on in comparison to other parts of our economy?
I probably was more familiar and more of an advocate than most of my colleagues when I was state representative. And because I would be coming in from Duncan at the beginning of the week and going home at the end, by the time I was Lieutenant Governor, I used to talk about the incredible growth and the change in the appearance along Lincoln Boulevard north of Interstate 40 toward the state capitol because of the growth here at the Health Science Center and with the Presbyterian Research Park. So it has, most legislators are no different than most people in the Oklahoma City metro area. They are quite surprised when they have an opportunity to tour the health science campus and learn everything that we have here. And as you indicated, I think we had that $500 million number came from an event that was held last spring where Leadership Oklahoma City invited those members who had been graduates of their program to come back and spend several hours here on campus. And we prepared documents that indicated that $500 million worth of capital construction had gone on in the last 4 or 5 years, and most of those people had no idea of how this had changed.
I also want to take a break here and also welcome Jorge Chorneco. I'm pronouncing that right. We've met before, but I've been to your offices, and you were one of the architects that worked on Children's Hospital.
That's correct. How are you, Steve?
All right. Thank you for joining us. I know you had a little bit of technical glitch there, and we're all new to this, so we can all just kind of fumble through this, and we'll be fine. But I did want to welcome you on board. We're talking a little bit about the history and all that, and a little bit I'm wanting to get into the design and planning of the area. And I'm going to get into that through a roundabout way. Lieutenant Governor, the Presbyterian Health Foundation Research Park is in a deal to be sold to the University of Oklahoma. My colleague Dom Mecoy did a story on that, I believe, about 2 weeks ago, where the transaction was announced, and the foundation is going to use the money to get back more into the business of issuing grants, which I'm sure could have a big boost to the area as well. But talk to us a little bit more about why this transaction was considered and how you think it'll benefit the area.
Well, I can't necessarily speak to how it was considered, but let me tell you that before the Stevenson Cancer Center opened in July of 2011, our offices, our administrative offices, were over in the Stanton L. Young Biomedical Research Center, one of several medical research buildings on campus. And through the 4 or 5 months that I was there, I was able to learn that we were already full. The newest research building on campus was already being utilized to its maximum, and yet our health science research on this campus was continuing to grow. So there was a need, as Dean and others were involved, to study long-term what kind of laboratory research buildings were we going to need to build in the future. The opportunity for to look at what was available in the Presbyterian Research Park, to me, seemed like a win-win, really a win-win-win. It was a win for the OU Health Sciences Center because it provides us some laboratory space that was much more affordable to be able to buy what was already built than to start from scratch. It provides the Presbyterian Health Foundation an opportunity, as you indicated, to have more cash flow so that they can go back to the business of awarding grants that clearly help us in the biomedical field. And the third win is for the research scientists in the Oklahoma City area that will benefit from having these additional grants.
Do you see this also allowing for more incorporation of the research park into the overall branding for OU out there? Do you see a rebranding for the park itself?
You know, as a newcomer among those that are part of this panel today, I think it's a great opportunity to elevate the amount of and the extent of the research that goes on here on the health sciences campus, I would tell you that more legislators are aware of the wonderful work that goes on at Oklahoma Medical Research Foundation than they are about the specific research that goes on here on the Health Science Center campus. And so the opportunity to show that this is a growing enterprise that not only helps us from recognition nationwide for the level of research that's going on here, but is such an economic development boon. Nearly every laboratory scientist that we recruit to come here usually brings or creates a staff of 6 or 7 other people. And every one of those jobs is at higher than the average per capita income for the state of Oklahoma. So the opportunity to create those good paying jobs gives us an opportunity to help be an economic boost, if you would, for Oklahoma City, Central Oklahoma, and the state as a whole.
Another thing we saw in connection with the research park is we've seen some pretty high dollar deals announced, including Solexis being acquired for $665 million. It's said to be the largest pharmaceutical deal for an Oklahoma-based company. Do you see similar deals in the future? Do you see Oklahoma City continuing to rise in prominence with this sort of activity out there?
You know, from my standpoint, I do. I really believe Oklahoma has reached the level now where we are able to recruit well-known research scientists, and the funding that we are able to bring into our laboratories here are creating these great opportunities for new discoveries and then allowing the commercialization of that discovery into a new business here in the state of Oklahoma. This wouldn't have happened 20 years ago. And now we have created the reputation that people in the pharmaceutical industry, people in the biomedical research industry are no longer surprised when they hear of the research discoveries and the successes that are happening here at the Health Science Center.
As I was doing preparation for this hangout, I watched the commercial for the new OU Medicine or Medical Alive and Well campaign, and very stunning. Scott, I'd like to talk to you a little bit about the children's hospital aspect of it, because it was really the superstar of that commercial as far as I could tell. That stunning lobby, which I'm also going to want to talk to Jorge about after you, but it really just stands out. And I've got to tell you, my younger child, he has some hearing problems, and I've been a frequent visitor to Children's Hospital, both at the old facility and now to new facilities, including the physician's building. And talk to us a little bit about the importance of this new, truly iconic addition to the area, the change in image. I mean, the old place was just really institutional. It wasn't very uplifting, and this new place is just incredible. I mean, my kids wanted to go there.
Well, I think that's a reaction we get from a lot of our patients and families. The simplest way I can describe what it's meant to the hospital and to our employees and physicians is we now feel like we have facilities that match the care that we provide, and it really provides an inspiration to the people that come to work every day at Children's Hospital. It gives us something to live up to, because there's an image now that's created when a family walks in our doors that they're coming into something special. And I know our employees and physicians deliver on that, but certainly we now have a reminder every day as we approach the hospital.
Jorge, tell me a little bit about the opportunity you had to work on Children's Hospital with the atrium and the recently opened rooftop garden. You had an interesting site to work with there, didn't you?
We did. We had the existing hospital to the east and an old parking garage when we started the project. So it was a bit of a challenge. We also had some grade issues that we had to deal with, but we took advantage of it in order to try to create what you see there today.
And I remember going in that rooftop area with you before this all, before it was done. But is that the kind of opportunity that we need to keep on looking for out there in terms of space that you would have written off before and trying to incorporate it? Because I know that land's getting pretty scarce out there, isn't it?
Right. Well, that space is over an existing mechanical room, and the trust asked us to take a look at the space and see if there were any opportunities to enhance it. Also, the hospital has the zone, which is an area for long-term, it's patient interaction area that they have. And we just decided to capitalize on that. And the trust provided us with the resources to get it done. And we partnered with some companies that do this kind of work for Disney World. And it was a great opportunity. We were really pleased. And my son was running around making quite a bit of noise during that grand opening.
Let me pose some reader questions we've had. And a lot of people, let me first get into a question, and I'll pose this either to Dean or Jerry. One of you can answer this. But, going back to the branding, what do we call this area? Is there one thing we can call it? I mean, Lieutenant Governor, do you want to take a stab at that?
Well, Dean's been here long enough that he's probably watched the efforts made to try to figure out how to brand it. The entire area connected with the OU Health Science Center is really known as OU Medicine. The hospital is OU Medical Center. We have the different colleges of medicine, nursing, dentistry, etc. And then certainly the hospital's separate identity like children's. And then the facilities such as the Stevenson Cancer Center and the Harold Ham Diabetes Center are all part of a wonderful umbrella called OU Medicine.
So, Dean, if someone's going down to Lincoln and 13th or any of the facilities in here, do we refer to it as OU Medicine then? I mean,
actually,
you understand what I'm trying to get
sign.
into as far as sense of place goes.
Right. No, not for sign purposes. OU Medicine is more of a brand and identification of the overall enterprise, primarily consisting of Children's Hospital, the Adult Hospital, the College of Medicine, and OU Physicians. And so those four really make up the OU Medicine tag. As far as designation and what we've become, it's really the Oklahoma Health Center.
Okay.
And, you hear OU Health Sciences Center, and that's more of the University of Oklahoma, College of Medicine, and the other 6 colleges. We're actually right now developing a global signage campaign that's going to take into consideration the entire enterprise. So it'll be a mix of the university, our hospital partner, OU Medical Center, and the other entities. But we do need to make it more convenient and really simplify wayfinding here on campus. It's a tremendous challenge, not only externally, but internally. Internally, I think we're doing a good job of wayfinding with these new facilities. We're not spread out like we were. So parking is a lot more accessible to walk straight into where you're going and get right to your clinic or room wherever you might be heading. Externally, it's still a challenge. We do have a consultant company helping us identify how to make it easier for our patients and visitors as they arrive to the campus.
Let me pose this first question to probably Jerry. This is from one of the readers that have posed a question. This is from Larry. He says he works in the Oklahoma Health Sciences District. Said he went to school there. He said, I am disturbed about the design of the newer buildings. He doesn't see them as being pedestrian friendly. He said the main entrance of the new cancer center forces pedestrians to walk in a driveway. And he also saw a couple of signs, I guess, saying, asking pedestrians not to walk on the grass. He wants to know if there's possibility of having a master plan to make the area more pedestrian friendly, if there's any way to create more, just walkable spaces. Is that something that's been talked about?
I know that it has been talked about in the years past, and I feel confident that the design of the buildings that we have, which as Jorge mentioned earlier with the grade issues they had with the new entry to Children's Hospital, there were certainly grade issues along 10th Street as the cancer center was being built. That's why you don't see a walkway at this time that connects OU physicians to the Stevenson Cancer Center, but at least for our patients, which is our primary focus. We put the attached parking garage on, right next to the cancer center. So as Dean said, we try to have access available for our patients. I know from just my observation that there have been more sidewalks and walkway areas and even picnic tables and respite areas in green spaces around our campus. So I would say that the master plan that the Hospital Authority and Trust and the Health Science Center campus has as a whole really is taking into consideration the concerns expressed by Larry.
I know that as part of MAPS 3, there's a streetcar system being planned as well. And at one point they talked about seeing if they could get federal dollars to extend that into the Oklahoma Health Center area. Do you think they've not been able to get the funding to do that to date, but do you see a possibility of that in the future? Is that something you all would like to see? Jerry, you want to comment?
That's probably more Dean's line.
Dean?
Yes, we have discussed this with Oklahoma City. I think President Bourne is very supportive of anything that we can do that connects us with downtown. As you can see with the maps, all of the activity, our growth primarily is to the south. They're certainly growing our way. So anything that we can do to make it easier for our patients, the people who work on campus here, our physicians and our staff and nurses, if they can access downtown on a lunch break or whatever might be convenient for them, we certainly are for that. And I think Oklahoma City is very supportive of embracing that idea as well.
Let me get another reader comment to you. This one is from Sid Burgess. Says, Jerry, first, we love you. So you've got a fan out there. Says, second, do you see the healthcare development and changes being driven in Oklahoma City, primarily by institutional programs or private research facilities? Does that make sense?
Well, Sid's a great high-tech guy, and what I would like to think that the Cancer Center, the Stevenson Cancer Center's new facility, is an example of an opportunity to build a building that includes the newest technologies, as well as looking forward to the future about what we can keep up with the newest innovations that occur. It's essential in medical care that our doctors be able to communicate with referring physicians from around the country, from around the state, and that the medical records and the communications internally are expedient so that care is not delayed for lack of records being moved along. The same is true in the research aspect. And so you see the buildings that are being built with consideration for what can we do to make sure that the OU Health Science Center continues to be on the cutting edge, because if we're not going to be able to either retain or recruit those outstanding medical providers or research scientists that we want to come here.
This question for either Jerry or Dean. As we see the area grow, do you see the prospect of more student housing being built in the area? Do you see the prospect of more commercial services being incorporated, whether it be cleaners, restaurants, what have you? Or do you see this area pretty much being kept to just medical and research development? Dean, you want to take a stab at that?
Yeah, this is Dean. Absolutely. Here at the in our children's atrium, we have partnered with a local vendor, Camps 1910, to provide a setting for a coffee shop and sandwich shop. We partnered with Bank First for one of their branch banks to be here, located right in the education center that I'm sitting in today, the Samus Education Center. And beyond that, I think dry cleaning is something we're looking at, a daycare center possibly. So anything that we can do to make life more convenient for our faculty and staff and others, we're going to do it, and we're going to pursue those opportunities.
Jorge, do you see the design and architecture going into future projects in this area changing as the whole field of medicine evolves, and as we hear this discussion of mixed use? I mean, does that change how you do your job?
Well, technology certainly plays a large part in healthcare design. Also, we need to. It's important that the universities stay relevant as they go after different researchers and different physicians as they try to recruit. So we certainly look at trends and the direction that things are headed. Multi-use is something that we always like to see as architects. The more diversity we can get into an area, the better. And that's what we try to do with the atrium by bringing in the bank and camps, is try to increase that traffic flow through the space.
Chuck, do you see the design and the whole development of Children's Hospital raising the bar for what happens in the future for that area on future projects?
Well, absolutely, and it's already leading into some projects over the next couple of years that will build off the atrium, the way that we flow our outpatient surgery volumes and patients through to the hospital, and capturing that atrium designed to have those services that we've just talked about, whether it's the camps market that families can go and eat at. So we're really building from that atrium design as we move into the next phase of Children's Hospital projects. And right now we have about, Jorge, $30 million or so of children's projects in the next couple of years we anticipate starting.
Dean, are we looking at any major new building projects coming up over the next few years?
We are. It kind of goes back to the research park and the purchase by the university. That is actually what we were approached by Dr. Dwayne Andrews, who's the provost and senior vice president of the campus and executive dean of the College of Medicine, talking to us about the need for research space. And so we started putting our dollars away, planning for the future to help provide services to them in that endeavor. As it turns out, that will be pretty much fulfilled for at least the next 5 years or so through the research park. So what that allowed us to do is look at another need that the College of Medicine desperately has, and that is for academic space for their various departments. And so we are in the process now of selecting an architect and a contractor to build about 120,000 square feet of academic office space for the College of Medicine.
Where do you see that being built?
The space designated is called what we call the resident lot. It's just south of the Samus Education Center, next to a parking garage that serves across the street. So it's on the Stanton L. Young Parkway.
All right. Well, we've hit our half hour. I really want to thank all of you for joining us for the first OKC Central Google Hangout. I was about to say gang out. Thank you all very much. I appreciate your time.
Thank you, Steve.
Thank you.
Thank you.
This is Steve Lackmeyer again, News OK. You've joined us for our first Google Hangout for OKC Central. You can follow my ongoing coverage of downtown urban core development either on my personality page at newsok.com/Steve Lackmeyer, or you can follow my blog at www.okccentral.com. Thank you very much. You can join me next Friday for our regular OKC Central live chat.